Thank you very much for staying with us on the AM show. Now, from the politics and the legal action, we continue with health. Ghana, like other tropical countries, is endemic with a number of neglected tropical diseases that, if not addressed, will derail the gains made in public health. It also has implications for the development of the country. These diseases include the likes of trachoma, intestinal worms, river blindness, bilharzia, elephantiasis, sleeping sickness, buruli ulcer, leprosy, yaws, and many others. To discuss the day, highlighting these neglected tropical diseases and what the way forward is, especially in Ghana, we have joining us Edward Tehevi, Chief Biomedical Scientist with the Ghana Health Service. It's a pleasure, sir, to have you join us this morning on the AM show. Mr. Heavy, good morning to you.
Good morning, Echo.
So this is actually Benjamin interacting.
Oh, Benjamin, my apologies. Good morning to you and good morning to your listeners.
That's fine. That's fine. So let's start from here. What are the basics we should know? Globally speaking, over 1.7 billion people affected by some of these diseases. What are some of the other statistics to know when it comes to these neglected tropical diseases?
Thank you very much, Benjamin. NTDs in country, we have about 14. In country, we have about 14. And the very good thing about it is that these are conditions that can easily be eliminated. Ghana has made a lot of inroads. As we speak, lymphatic filariasis, otherwise known as elephantiasis. We have broken transmission in 99 out of the 114 districts. So that is a lot of impact. We have 15 hotspots that are outstanding. Trachoma has been eliminated as a disease of public health significance. That was in August 2018. Guinea worm has also been eliminated from Ghana. So these are the significant progress that we have made as a program in Ghana. So it's not all that gloom. So all these affected people live in very poor endemic communities, and attention needs to be focused on them.
So we're going to be talking about some of the dynamics, but help us understand what exactly are these parasitic, viral, and bacterial diseases? Why do we even call them neglected tropical diseases?
Thank you. I would like to begin by quoting the former Director General of the WHO, Margaret Chan. She says, NTDs thrive under conditions of poverty and filth. They tend to cluster in places where housing is substandard, drinking water is unsafe, sanitation is poor, access to healthcare is limited or non-existent at all. Insect vectors are constant household and agricultural companions on food. So she has put together what the NTDs are. These are diseases that affect the poor, they lack a political voice, they are marginalized, they are stigmatized, and they don't seem to have any hope at all. So we as a health sector, we as a people need to come together, pool our resources together and help combat these diseases.
So quite some dynamics there. We'll later on look at the bit about poverty again. But what is the current situation of these, neglected tropical diseases when it comes to Ghana specifically? As I indicated earlier, 1.7 billion people affected across some 149 countries in Asia, Latin America, Africa, some of the poorest countries. But what are the real dynamics? You talk about Guinea worm and the others in Ghana. What are the statistics?
Right. In Ghana, we want to broadly put the NTDs into two categories.
Right.
We have the case management and neglected tropical diseases, such as buruli ulcer, leishmaniasis, the human African trypanosomiasis, and then we have the PC NTDs. PC stands for preventive chemotherapy. So you administer drugs en masse to an endemic community, and you expect that they are treated. So we have soil-transmitted helminths that affect mostly school-age children. We have elephantiasis. We also have onchocerciasis. We also have trachoma that has been eliminated, as I said. So trachoma was endemic in the northern region, the northeast, the savannah, and the upper west region. Onchocerciasis is prevalent in all the regions with the exception of Greater Accra. Lymphatic filariasis is endemic in all the regions with the exception of Volta region and Ashanti region. They don't have figures that we can call for intervention, but even that one, I still think there are some pieces of work that we need to do with that, because that was at the time of baseline study. The dynamics have changed now. So almost everybody in Ghana, almost every region has two or more of the neglected tropical diseases.
Which is quite a concern there. And how exactly thus far has the health system, the Ghana Health Service and others, how have you addressed these challenges that you're pointing out to me now? How have you addressed them and what is the way forward?
Right. We have enjoyed a lot of support from the government, but like Oliver Trace, we humbly ask for more. They provide our salaries, our office space, the vehicles with which we move to the communities. We have been largely supported by our partners. A lot of partners have come in to support the Ghana Health Service. So our modus operandi is to move into the endemic communities, educate them, treat those who are affected, and those who have the conditions, we manage them. So the preventive chemotherapy that I spoke about, you give out the medicines en masse, it means you are trying to prevent the people from getting the disease. Those who already have the disease, as I said earlier, you try and manage them. That is what we call morbidity management. And that's why we have been doing it constantly. And we have made a lot of inroads, as I said. Unfortunately, the advent of COVID has slowed down a lot of activities and the support for the program because all attention is now on COVID. But then these diseases still exist in our communities. The people are suffering, and we don't want to wait till the whole country is overwhelmed with the diseases before we go out and support them. The time for action is now.
And I couldn't agree with you more, but you took the wind out of my sail when you spoke about COVID and how it's related to these neglected tropical diseases. The question I would like to pose there is, what has been the real impact or the real challenges when it comes to dealing with these diseases and, on the other hand, having COVID-19 in the system and all the attention that is paid to it? Are we neglecting further these diseases on the back of COVID-19?
Yes, Benjamin, you hit the nail right on the head. Right on the head. These are people who are marginalized. They don't even have the resources. So on the back of the COVID, even the resources have further dwindled because a lot more has to be done to stem the pandemic. But then these ones are also still there. Now, we haven't stopped working. We are still doing what we have to do. But we all know that we are not in very normal times. So going out is a huge challenge. Making contact with people is a huge challenge. And that has somehow slowed down our activities. Nevertheless, last year, for example, if I could give you an example,
sure,
we couldn't go to do any deworming activity in any of the schools because the schools were closed down and the children were at home. And we are talking about school-age children who are badly affected by soil-transmitted herpes. And the impact is so bad. They have attention deficits, cognitive development is impaired, they are not able to grow very well, they are not able to stay in school, absenteeism, and it affects the academic progress. Some suffer from stunted growth. So the deworming exercise was making a very huge impact on the academic performance of the schools. And we have worked tirelessly with the school health education program towards achieving that goal. Now that the students have returned, how do we enter the schools in the wake of the pandemic? There are communities that we need to go in there and treat. In the midst of this pandemic, how do we move forward so that we don't go and spread the disease any further? So these are the challenges currently confronting the program, and we need to do something.
So that's pretty, disturbing, because we're talking even intestinal worms. They form part of some of these tropical ailments. But I would ask you, you're asking about the how. How do we? I would throw it back to you. You are in the system. How is it going to be done?
Well, honestly, we still have to go out there as we usually go, and then making sure we work with the COVID protocols. A lot of experts have spoken on the COVID, and then we know when we put in place a lot of the protocols, hand washing, wearing of face masks, making sure there is physical distancing, covering our nose with our nose masks, we should still be able to do some work. We should still be able to do some work.
Okay.
So we just have to employ the protocols and make sure we go out there and work.
Some very brief bits before we take leave of you, Dr. Hervey. Two very brief things. Now, the first one, what is the link between these illnesses and poverty? What should people be looking out for?
I'll give you an example. If you take something like elephantiasis, I have seen a very bad case of elephantiasis before. The person was the breadwinner of the house, a lady, both hands were affected, both legs were affected, both breasts were affected. So she was unable to go out because of stigma. People shunned her company, she lost her source of income, and it kept the whole family in the cycle of poverty. This is exactly what happens with the neglected tropical diseases. Once one is affected, it keeps you in the cycle of poverty. So we want to ask for support from the media to help us publicize the NTDs. All stakeholders should come on board, especially the corporate world, because we need resources. As we do education, tell people about the NTDs, stigmatization is reduced. I'm sure Ghana will be a better place, and the world will celebrate us as they did when we eliminated trachoma. In fact, let me put it on record that Ghana is the first country in sub-Saharan Africa to have eliminated blinding trachoma. And we are doing a lot more. Human African trypanosomiasis, sleeping sickness, and very soon, you'll be hearing from the Ghana Health Service the progress that has been made.
So water, sanitation, and even clustering, like we see in our slums, also resulting in these. But I can't let go of you before doing this. What is the theme for this year's celebration, the World Day with regard to neglected tropical diseases? What is the theme?
Thank you very much. Our theme is face the NTDs and the neglect. Face the
NTDs and the neglect. Right.
And the neglect, right.
Well, we wish you the very best, and we pray that we'll be able to reach out to the most affected when it comes to these neglected tropical diseases. That's been a Healthy Thursday edition as we talk about the NTDs. You should indeed read more about them and how you can help alleviate those who suffer NTDs. That was our discourse with Dr. Hervey, on our Healthy Thursday belt. It's time now for Showbiz that comes your way next on the AM show. Do stay with us.